Good evening, everyone. Alright, it is 7 p.m. now, Friday, May the 1st, 2020. We are in National Palace in Mexico City, and let's begin with the conference, with daily press conference regarding the COVID pandemic situation, which is the disease caused by the new coronavirus SARS-CoV-2. Today we'll be focusing on three topics. First one will be the daily technical report presented by Dr. Alomia, and topics 2 and 3 will be a follow-up on what we discussed this morning during the presidential conference. And for those two subjects, we have a very special guest, which is the governor of Mexico City, Claudia Sheinbaum, and we also have our dear friend, the director of IMSS, Zoe Robledo, and they'll be talking together about what we were talking about this morning, and later we will open the Q&A period. We are currently at the day number 40 of the national campaign for safe distance, and we still have about a month left. So we need the support of everyone to continue to stay at home. And as you can see, as we have been saying, we are currently at phase 3, meaning we are still experiencing an upward trend. So we are having an ever increasing number of newly confirmed cases, but definitely less than we would have had if we hadn't adopted these measures. Thank you. Alright, let's begin with the daily technical report. As you know, we will begin by analyzing the international state of affairs. We can see how worldwide the pandemic continues to decrease. The percentage of active cases are now near 1/3 of the total amount of cases that have been confirmed since the first case of the pandemic was reported. We are talking about a 35% now. And we can see how the European region continues to go down in terms of their representation in this chart. And now the Americas account for 49.2% of the active cases. So we could say that the active pandemic is concentrating in the Americas now. And a lot of the countries within the Americas, with the exception of the United States, entered the pandemic quite late. So we have a delay of 1 month with respect to the European Union. These are our numbers for the national situation. We have 20,739 cases confirmed so far, but only a little less than 1/3 are actually active right now. So we have 6,390 active cases, and this is the active pandemic right now, which is also distributed unequally through the different states of our country. We have 15,446 suspect cumulative cases, and you can, if we take into account the positive result rate, which is now near 50%, we're talking about a situation in which 5 out of 10 suspect cases get confirmed for COVID-19. Unfortunately, we have 1,972 fatalities so far, over 55,000 cases that have tested negative, and in total we've had over 91,000 patients that have been studied. Since the monitoring of this disease began in Mexico, and we're talking about January 16th, which was the date in which Mexico developed and had available the test for confirming the cases of COVID-19. We have the burden of disease distribution per state. And remember, we are talking about the cumulative confirmed cases, meaning all of those cases that have been confirmed since the pandemic started in our country, and their distribution per state. Of course, we can observe that a lot of the states are showing now orange, even dark red colorations, which indicate, of course, a very high concentration of cases per state. Next chart, we have the same distribution, the same colors, but there we present the actual, the raw numbers, so you can observe the distribution per state. Here we have a similar map, but now we are just focusing on the active pandemic. So this is the 6,390 cases that are currently active right now, and their distribution per state. We see how some states are appearing yellow now, a few more appear in orange. And of course, the Mexico City and the Mexico State area are the ones with the highest concentration of cases. And of course, some of the states that appear in green will continue to concentrate more cases as time goes by. Here we have the same information presented in the way of a bar chart. And now we can take a look at the incidence rate. Remember, this is calculated on the basis of each state population. We're referring to the number of confirmed cases, confirmed active cases in this case, per 100,000 inhabitants per state. Next slide, we have the same distribution, but now in the form of a bar graph, so you can identify which states have the highest rate and which state has the lowest rate, and every state in the middle. Now we are looking at the fatality distribution per date of occurrence, and as you know, we are including those fatalities that are currently suspect fatalities, meaning that we are waiting for the results of the test in order to either rule them out as COVID-19 caused deaths or categorize them formally into the statistic. Because this data is presented by taking as reference date the date of the death, and we will continue to see this data stabilize and show some variation during the upcoming days. We have few suspect days so far. We have we have been solving the status of all suspect deaths as we move forward. We haven't accumulated a great amount of unresolved suspect fatalities. So far we only have, or currently we only have 164. Here we have the same information presented per state. So please do remember that these yellow sections could turn into blue, or at least a part of them could turn into blue, depending on the results that come out during the upcoming days. Here we have the fatality. Sorry, here we have the suspect case and the confirmed case chart. Remember the distribution per date of beginning of symptoms. The red part is the confirmed cases, the yellow part are the suspect cases, and we present them together also to be able to look closely at the trends and to take into account that if a portion of these, on average, take into account the positive result rate, on average half of these yellow proportion could turn into red as the tests come out, and then some cases are confirmed. The trend continues, and it matches our projection and our prediction for phase 3, for this phase 3 that we are currently on. This is the proper beginning of the curve, and it's a curve that will have to go on and continue its path and eventually start to slow down. The big difference is the inclination, or the sharpness of this curve is relatively low compared to the ones that we have observed in other countries. Here we have the cumulative burden, meaning all the total amount of cases confirmed to this up to now. They appear represented on the curve, and we also have the little orange bars that represent the daily newly confirmed cases. We just had 1,515 cases confirmed during the past 24 hours, which means a 7.9% increase with respect of yesterday. And we can continue how, in this regard, the trends also continue to show a similar behavior that like the one we have observed in the past. Now here we can take a look at the occupancy, at the bed occupancy nationwide. This is information that we get through the IRAG network. IRAG stands for acute respiratory infection, and these kind of beds are notified by hospitals all over the country. For this report, for these 24 hours, we had 649 hospitals who notified. Out of and yesterday we had, but this data, because some hospitals are still presenting their information, but yesterday we have 14,000 available beds, and these and out of these there is a percentage of beds that are occupied by patients, but these patients were not intubated patients. They were stable hospitalized patients. So talking about the occupancy, on average we had an occupancy of 28%. If you remember, we started presenting this report last Saturday, so today we are looking at a week now since we started presenting this information and monitoring the number of available beds. We started at a 20% occupancy, and now we are at 28 occupancy, so we had an increase of 8% during a week. As I said, we have over 600 hospitals that are notifying, and we have had an increase in the number of notifying hospitals. We are now at a 95% of hospitals who are notifying timely their information. Here we have the occupancy rates per state. This is the national distribution, and according to each state we also can take a look at each state occupancy rate. Obviously, Mexico City continues to lead the way when it comes to occupancy. We are now at a 68% occupancy. Baja California is at a 58% occupancy, and the state of Mexico is at a 46% occupancy. These are the highest percentages. Now, those were the general beds, hospital beds. Now we are talking about ICU beds. beds that have a ventilator available, and a team of specialists available to provide intensive care, because we are talking about patients who are showing respiratory failure and they are exposed to a much greater risk to have a fatal outcome. Now, Mexico City continues to lead the way, Baja California and the state of Mexico as well. They remain in the same positions. We're talking about 61% occupancy for Mexico City, 49% for Baja California, 46% for the state of Mexico. And these ones are the ones that have the highest occupation in the whole country. And by this we mean they have the lowest availability. That would be my information for today. Alright, I'm gonna be introducing the second topic, which is a follow-up on what we were talking about this morning on the presidential conference. I want to call your attention to a very important news that we have been discussing for weeks, but it is the fact that this pandemic is not distributed in our national territory in a uniform way, meaning we don't have the same intensity in the propagation of COVID or of the virus, the new coronavirus SARS-CoV-2 across the country. But we have specific areas, specific zones, especially urban areas that have higher rates of transmission, and unpopulated areas, rural areas that have lower rates of transmission. We have been following and we have been monitoring this distribution, and we have been presenting this information in the form of an interactive municipality divided map. So we have, as we're saying, we have a mixture in our country of areas that have very, very low transmission, very mild transmission, very low number of cases. And we also have areas that being, even though they are very big metropolitan areas, they haven't reached important transmission rates. And I would like to emphasize the case of the city of Guadalajara, the metropolitan area of Guadalajara, and the metropolitan area of the city of Monterrey. These two cities have maintained a low transmission during the past few weeks. And probably it has to do with the fact that the first cases in these two cities appeared 26 or 24 days after the first case nationally. So Mexico City had the first case February 28, but Guadalajara had its first case in March 26. So it all started when the massive mitigation measures were already being implemented. Remember, the suspension of school activities began on March the 23rd. And remember that the General Education Council dictated that school activities were going to be suspended, and they were suspended on the 23rd of March, but it was also allowed for those states who could immediately suspend activities to do so. And that was the case for the state of Jalisco. They suspended school activities 1 week before that other states. But what I want to emphasize is applying the following of these measures had a great impact and allow these states to maintain low transmission rates. Now, what I want to say is For those 5 areas with high transmission rates in our country, we have re-coordinated our strategy in collaboration with federal authorities, state authorities, and municipal authorities. So in a minute, Claudia will be talking about the model specifically for Mexico City. But for now, I would like to show this information so you know in which stage of the pandemic are you, depending on which state you live in. This is data that was collected, analyzed, and presented by a very talented group of mathematicians from National Autonomous University, that were coordinated by CONACYT. So we are presenting the dates on the bottom part. For example, 31.03 means March the 31st. 28.04 means April the 28th. And here what we see is the predicted number of cases on the vertical line. And the red line is the projection for each of those dates. So for the case of Cancun, and this is the slide for Cancun, the prediction indicates that we will reach the peak, the maximum point, the maximum point during these dates. Yesterday we were talking about this with officials from the government of Cancun, and they were telling us that this inflection point, this slowdown point, hasn't manifested itself yet, according to the data that has been observed, but they have indeed observed a decrease in the number of people who are falling ill and going to the hospital. I want to be very clear about something, because this applies to the 5 cities that we are going to be talking about. We will be seeing that 4 of these cities are in the middle point right now, so meaning we are starting to see light at the end of the tunnel, to speak metaphorically, meaning that we are starting to reach the inflection point in which we can start slowly coming out of the pandemic. But this does not mean at all that you can relax or that you can suspend the massive mitigation measures, meaning the interruption of school activities, of work activities in non-essential sectors for the economy, and the limitations to public gatherings. All of these measures cannot be interrupted quite yet. These restrictions will not be lifted, and they shall not be lifted, because if we lift them prematurely, we would have a change in the trend, and we don't want to see that change in that trend. So these predictions and these projections that we are presenting are only valid if and only if we continue to abide and to comply with the measures we've been complying with so far. Today we talked with public officers from these areas, including Mr. President, who talked to 4 different governors, and with the governor of Mexico City, who was here this morning, as you remember. So, focusing on one of the most concerning elements, which is the ICU infrastructure, the conclusions is that we still have enough capacity to provide for maximum demand. But also there's been a number of resources that have been allocated by the National Institute for Health to different hospitals that require them. So there was transference of human resources and of patients as well. And all of these transference operations are from the public sector into the private sector, either from doctors, from patients, from public hospitals into private hospitals. And this is all part of the agreement that was reached from several weeks ago between the public sector and the private sector. But the new piece of information, and the director of IMSS will be talking about this briefly, is that IMSS can now offer under this new modality the that now IMSS is going to be providing health care for people who are not affiliated to IMSS. But we'll talk about that in a minute. Now let's look at the data of Baja California. In Baja California, there are two cities that are part of one same epidemiological region, so to speak, even though there are two independent cities, but they have great connectivity. And we are talking about Tijuana and the city of Mexicali. These two cities, we are close to reaching the peak and the following slowdown and the inflection point, so we can start observing a downward trend. So this inflection point is gonna arrive more or less at the same time in Mexico City as in these cities. We're talking about May the 6th, May the 8th. And for the city of Tijuana, we also see similar dates, but same thing. Measures from the National Safe Distance Campaign will not and should not be lifted. The restrictions should not be lifted, and the measures should not be interrupted in Mexicali and also not in Tijuana, because then these projections will not be fulfilled. The government of Baja California purchased 70 ventilators, with which we can incorporate the services that Mr. Robledo will be talking about. And also thank you to Mr. Bonilla for his collaboration with this whole situation. Now, Culiacan, Sinaloa. What I'm presenting right now are not new cases.
These are not new cases. I forgot to be specific about that. This is about occupancy rates in ICUs. And what this curve shows us is that it shows us how many people each day are in the ICU. In Culiacan, we also have good news. About 3 days ago, they passed their peak, and they very possibly might be going towards stabilization and later decrease. These are people who are hospitalized in the ICUs. All my respects to the governor and to their head doctor in Encinas. Here we have occupancy available. There's still beds. INSABI sent 301 personal human resources support staff. We have health professionals, nurses, doctors, and the Ministry of Defense also has planned to open another hospital in Culiacan in the next 10 days. And there they will need 50 ventilators, and they have bought these, and that has been authorized, and that has been done on behalf of INSABI. There was a problem with oxygen at their civil hospital. This was a problem with engineering, and they resolved that and transferred patients under the agreement that we signed at the national level. Tabasco, Villahermosa, Tabasco. This is still in the stability point. They're not having an increase in cases, but we don't have a clear signal that they are going down in terms of number of cases. Sorry about having a very small piece of information to read here, but we're thinking that in the next couple of days, we will see a greater reduction in the number of new cases. And I have to tell you that this has to do with occupancy in ICUs. If we have fewer people who are going into ICUs, this is great news. But if they are in the ICU for a number of days or for 10 days, then occupancy is still going to be at a higher percentage. The highest demand, the highest demand could for availability by 18%. They asked for 60 monitors, 3 ambulances, and 8 ventilators. And Insabi sent 841 personnel of essential healthcare professionals. Thank you, so many people. Thank you to all the people who heeded the call, answered the call to help. And thank you to Dr. Alejandro Esbarch. They're going to retrofit 3 hospitals. Tabasco is one of the states that came out with a retrofitting plan earliest. And the governor has been very much on top of things over there. And also the Secretary Silvia Roldan, who is an expert in public health. The Mexican Institute for Social Security is going to support them with 17 ventilators. Finally, Valle de Mexico. We have been documenting this, and we did this morning with quite a bit more detail. Right now, we can see that we are still on the way up with regard to our predictions for May 6th being the peak. This isn't necessarily about one day or 1 hour. This is between the 6th and 10th of May when we're expecting the spike. Now, since Mexico City is one of the highest has one of the highest transmission rates, we really cannot relax our massive mitigation measures. We have had our governor saying this emphatically many times, even more emphatically than me. Thank you, Governor. And what has been done? I'm not going to spend too much time here because we will end with that. But here we have the governor who is going to tell us about our new coordination plan. Thank you, Deputy Secretary, Dr. Hugo Lopez Catel. Thank you. Thank you for inviting us here today to this press conference. First, I'd like to talk to you about how we've been staying up to date every single day. We have the state with the most number of COVID-19 cases, and this is due to a number of factors. One of the most important ones is that we were one of the first states to have the first case. The first case that was registered was outside of Mexico City was a month after we registered our first case. And then we have our population density, 9 million people who live here. And then we have millions more who are part of the area right outside. We have 16 areas right beside Mexico City, and they also belong to the state of Mexico. So this has become the perfect storm for us to be the state with the highest number of cases. If we hadn't taken the measures recommended by Susana Safe Distance, then we would probably be at 4 times as many cases as we have now. This is the first thing that I wanted to comment on. The second thing is that today in Mexico City, up to last night, you must know that we're updating this every night. We have had almost 9,000 people hospitalized in intensive care. The Ministry of Health and our national health institutes, our hospital Gonzales in Juarez, and 5 more hospitals in Mexico have been earmarked as going to be for COVID. And we also had 1,900 people, hospitalized. As we have explained each day here, which we have called the negative network, which represents 61% of hospital occupancy in Mexico City. What do we do when addressing this situation? The first thing that was presented was today in the morning. The Mexican Social Security Institute has a very important presence in all of the Republic. We made a decision by the very director of IMSS so that IMSS could open their doors to people who do have COVID-19 or people who have symptoms. If they need to be hospitalized, they can do so at any IMSS Mexican Social Security Institute hospital, especially our national health institutes. On one hand with ISTE, and then on the other hand with our 5 other hospitals that are available. This is very important because we want people to know that we do have space in our hospitals, and you're going to see that we're going to present that ahead. The next part that I wanted to present is that we are going to enlarge our occupancy rate. Mexico City will also be incorporating 4 other hospitals that will be retrofitted, in some cases the whole hospital, in other cases just a part of it, to deal with COVID-19 patients so that we can have more capacity at the hospitals. That means that we'll have 130 ICU hospitals with availability of ventilators. We also still have to incorporate our Navy's plan and our N95 plan. And this will have a significant impact on how much occupancy we have at our hospitals. We are covered with this model that is being presented and more, not thinking just about the limit, but thinking about a scenario that is even more problematic or serious. We are prepared for the next weeks that are coming, which are going to be the most difficult weeks in the city. And this will happen until we see the number of people hospitalized go down, and we hope that will be around the 3rd week of May. This is an important message. Now, may I give my presentation? This morning, before the presentation was made, we saw a website. This is where you can see each hospital. There you go. This is covid19.cdmx.mx, and you can check out this map on the website. This website shows you on each point, if something is red, that means that the hospital is at capacity. If it's orange, it means that it's in the middle. And if it's green, it means they still have enough beds. This is available if you download any of our applications as well, our Mexico City application, app.mx. You can see there's information on there. The first thing you're going to find are the hospitals in Mexico City. We opened up the metropolitan Valle of Mexico area as well for that. So it's important for you to use this and see it and understand it. It's important for you to understand too that a hospital that is marked with red could go back to being marked with green. So perhaps there are some that are available, such as the INER program that said they were going to be getting more ventilators.
Si pasamos a la presentación,
Now let's go to the
muy rápidamente
presentation.
quiero decirles,
I would like
esfuerzo de
to tell
coordinación
you
que he
that
hecho
this
ya
is a coordinated
prácticamente
effort that we've
desde
been
hace un
doing for
mes
the
con
last
las
month. We've
instituciones
been working
Secretaría de
with the
Salud del
Ministry
Gobierno
of
de
Health,
México, el IMSS, el
IMSS,
ISSSTE,
ISTE, and the
y la
government of
ciudad
Mexico City.
destinó un
We have a
SMS especial
special SMS here
51515 que pueden
that you
ustedes
can send a message to
marcar en
51515.
su
You can send
mensaje
a
de
text
teléfono,
message,
ponen la
put the
palabra
words COVID
COVID-19
19
en un
in an
SMS
SMS text to
51515,
51515.
lo envían
You
y
send
comienza un
it, and
tamizado
then you will
automático. A
continue on
partir
with
del
an
tamizaje
automatic
automático, es
screening
decir, un
process.
cuestionario
You will
automático,
have a
se va
questionnaire,
reconociendo si puedes tener una
and they will
situación
help you
grave o
understand
no
whether you
grave.
have a
Hasta
serious
el momento han
situation or not.
usado este sistema
Up to now,
exactamente,
I
aquí tengo
I have the
el
information right
dato,
here.
232.981 personas que han
232,081 people
terminado.
who
Y
have
de aquí, si se considera
accessed
que es
this.
grave,
And if
tenemos
we
alrededor
have
de
people who are
150 médicos en Locatel
critically
en
ill,
todos
we have
los turnos
150
y
doctors
también en 911.
online to
Si
answer
se
your
considera que es
questions.
grave,
And
se le
if
hace
you're
una
in a
llamada a la
very
persona
serious
y
state,
la persona
911.
puede hablar
You can
directamente
call
con
and
el
talk to a
médico,
doctor right away.
inclusive lo
You
puede ver
can
en
even
celular
see it
para que
on your
pueda
cell
tener
phone
toda
so
la
that you can have
información.
all that information
Entonces, esto
available.
ha sido muy
This is
importante. A
very
la fecha
important.
se han
Up to
encontrado
today, we have
alrededor
found
de
around
7,000
7,000
casos
cases.
y además la
And
ciudad les
besides
lleva a su
this,
domicilio
you
un
can
kit
also
con
receive a kit from the
medicamentos,
state with
apoyo
food,
alimentario y
medicine,
una
and
tarjeta
a
con
card with
15 pesos
1,000
para que
pesos
pueda
on it
pasar toda la
so that you
familia.
can
15
spend
días es el
15
tiempo
days, which is the
mínimo que
minimum
deben estar en
time
su
that we
casa.
need you to
Hasta la
stay
fecha se han
at
dado
home.
más de 7,000 de estos
We've
kits
distributed
y se les da
7,000
seguimiento por
approximately of
teléfono a
these
las
kits up
personas
to
con
today,
sospecha de
and this is
COVID-19.
for people from telephone
Este
calls who
sistema
suspect
también se
having
puede hacer a través
COVID-19.
de
You can
Locatel.
also call Locatel.
Bueno, ¿qué es
What is
importante de esto y
important
por
here?
qué
Why is
es
it
importante
important
para lo que
for
estamos
what we
planteando
are
en la
planning
relación con el
with
IMSS?
regard to
Es que
EAMS?
lo mejor que se puede hacer
The
si
best
se
thing that
tiene
you can do if
síntomas
you
de
have COVID 19
COVID-19
symptoms
es
is to
utilizar
use
este
our
sistema
system
o hablar
or to call
directamente a
directly
Locatel.
to Locatel.
Y Locatel va a tener
There,
la
you are going to
información
get
en tiempo
information
real
updated
actualizada
in real
de
time
cuáles son los
so that you can know
institutos y
which
los hospitales del
hospitals
Instituto
for
Mexicano del
EAMS, the
Seguro
Mexican
Social,
Social
a las que
Security
puede
Institute,
acudir una
are
persona
available for you to
para que
go
no
to
estén aún con
so
tener
that you're
largos,
not
dando
going
vueltas por
all
todos
around from
lados,
hospital to
sino que en el
hospital.
teléfono
What's
con
better is
Locatel
if you call
dicen,
Locatel and you say, I
quiero
need
información sobre
information on COVID
COVID-19, se le pasa a
19,
un
you get to
médico
talk to a
y el médico le
doctor
hace una serie de
and they
cuestionamientos.
give you a
Si
questionnaire.
se requiere, por
If you
ejemplo, una
need an
ambulancia,
ambulance,
se pasa
then
al
you will be
911,
transferred to
otro médico le
911. You'll
contesta
talk to
y se
another
envía la
doctor and they'll
ambulancia.
send an
Y si
ambulance.
no, si la
If
persona
not,
puede
if
irse
that
o considera el
person
médico que es importante
can,
que
or
vaya a
if the
un
doctor
hospital,
thinks it's important for them
entonces
to
ya
go
a
to a
través de
hospital,
este
then
teléfono
they
se le
get
informa cuáles
information
son
on the phone
los
line about
hospitales del
which
IMSS o
EAMS
de otra
hospitals they can go
institución
to
a los
or
que
other
puede acudir y si
institutions
tienen
that
todavía
still have
espacio
space
para no
so that
saturar
we
los
don't
hospitales en las puertas,
saturate or
sino tener
make
este
hospitals
sistema que
get
es muy
closer
rápido y
to
que puede dar la
capacity than they
orientación.
already are.
Adelante. Estos son
These are the
los médicos que
doctors,
están, el personal médico que
the
está en
essential
Locatel y en
healthcare
el
professionals who
911.
are on Locatel and also on the phone line at 911.
Este es el mecanismo
This
y
is our
aquí
graph to describe it.
no
I'm
voy a
not
leer
going
las
to
preguntas,
read
pero
your
ustedes pueden
the
conocer
questions there,
cuáles
but
son las
you
preguntas
can
que se
read the
contestan para
questions and
saber
know
si se
what the
requiere
answers
una
are to see if
hospitalización.
you might need
Adelante.
hospitalization or not.
Entonces, sin
Now,
importar
without
si
it
tienen
mattering
COVID-19 o
whether
no, el
you
IMSS
are
va
a
bien,
card-holding
pero lo
EAMS
importante
carrier or
es que,
not,
ahora lo voy a explicar de mejor
you'll still
manera el
be able
director del
to get
Instituto
in.
Mexicano del Seguro Social, se
You'll be
dirijan a
able to
Locatel o al
call Locatel. You can
911,
call
ahí
Locatel
les va a contestar un
even if you
médico y
don't
les
or
va a
you're
dar la
not a card-carrying
orientación
member of
de cuál de
EAMS.
los hospitales
And they will tell
del
you what are the
gobierno de
government
la ciudad
hospitals in the
o del
city
Instituto
or
Mexicano del
the
Seguro
EAMS
Social que
hospitals
todavía
that
tienen
have
espacio,
space and you can go
de la
to them.
Secretaría de Salud
The
y Relaciones
Ministry of
Laborales con
Health
el IMSS,
or
a cuál de
EAMS,
esos
whichever
hospitales pueden
hospitals,
dirigirse
they'll tell
para que
you
no
which
tengan que
hospital
estar
to go to so that
buscando
you're not
la
looking for
unidad
the right one.
adecuada. Esto es lo que
That's what we wanted
queríamos
to
comentarles
let
el
you
día
all
de hoy.
know
Muchas
today.
gracias.
Thank you.
Muchas gracias,
Thank you so
gobierno.
much, Governor Shane
Ingeniero
Baum.
director. Muchas gracias.
Thank you. Thank you, Dr. Hugo Lopez Gatel. Good evening. Good evening, Governor Dr. Alomia. Over the last 63 days, Dr. Lopez Gatel, in a very patient way, has been telling the story of this very important part of our national panorama at the moment. We're seeing how there's going to be different behavior at different moments, and we're learning about all the elements of what's happening day by day. This is a great effort. I want to say congrats. Now, we've gotten to a point where our health system in our country, it's dealing with a reality that perhaps is very different from the rest of the world. I want to talk about how in this great city, we have 7 different health systems with 7 different models for ensuring people being admitted and let out. And this means that the public health system is completely different. So you can't say in one moment, well, if there are so many people who are infected and who need to be hospitalized, and you have so many beds and so many ventilators, things should match up. But it's just not like that. Today, from what we've been working on over the last number of weeks, and we're concreting that integration, and we're going to overcome traditional ways of doing things. We're going to overcome all kinds of barriers just because of this situation. We can't let this determine whose lives get saved, depending on which beds are where in hospitals. In the morning, there was another comment, and it's important to highlight it. As my in my position of director of social security, it's not about a legal, we have the legal obligation, we have a law. And when we have an emergency situation, social security has to attend to people even if they aren't card carrying members. And it's not because the law says that, it's because it's what's right. Human beings need to be this way. When we have the possibility of saving people's lives, it's because the Constitution says it. It's because the Hippocratic Oath says it. That the health professional has taken that oath. Now, Social Security on other occasions has done the same, and this time can't be the exception. Now, ISTE is written with SSS, they say. IMSS is written with SSS, and the last S stands for solidarity. And we need solidarity in pandemics, just like the earthquake in 85, just like in 2017. Solidarity is what has helped, as what has led us to help people in rural areas who don't have an IMSS card. And we're not going to be the exception now. Social Security has to be there. This work that we do is so important. It has very key elements. It has to be timely. It has to be quick. It has to be fast. People can't be stumbling over any kind of element to get attended to. For example, if people are suspected of being infected and they're still worried and they might get even worse, we have to attend them. It has to be orderly. People have to go to the correct place where there is availability of beds, just like Dr. Shanebaum was saying, so that we don't have all these terrible people going around and around from hospital to hospital looking for medical attention. And the other thing is that it be informed. That's something that exactly at this palace that we're doing right now, just from December 1st, and that great day that we're doing this very same thing for this coronavirus pandemic, starting at 7 p.m. It has to be something that we're doing with a lot of information. We have to be coordinating and giving a lot of information. We're not coordinating just with Social Security, we're coordinating with the government of Mexico City, with ISTE, with Pemex, with ISFAM, with private people as well, private members, private hospitals. So what I wanted to talk to you about today, that this exercise is going to have to continue permanently. We have 13 scenarios, sorry, and we want to know exactly what's going to happen in those 13 scenarios scenarios so that people who don't have an IMSS card can get medical attention. We wanted to make this as simple as possible. One scenario is a patient at home. They start feeling poorly. Could be Mexican woman or man, they're at home, they start to feel poorly, or they're with a family member or alone, and we're saying, please call one of these two telephone numbers. These are the telephone numbers that are most well known in this country. Locatel 55 56 58 11 11 and 911. Call them. What's going to happen when you call? Dr. Shanebaum just told you. You'll be able to talk to doctors there who will evaluate you so that they can understand what is the next step for you. When they determine that you do need immediate or urgent attention, then they are going to, in every case that they can, they're going to try and send an ambulance for you. Health professionals will be there and they'll be there in a hospital at your home. When the ambulance gets to your house, they will receive the patient and they know already which hospital they're going to. So the hospital is not just going to receive you, but we are going to say, we know that this hospital has a bed waiting for you so that there won't be hallway medicine. We're going to have to be perfectioning all of these movements, but this is the scenario that we want to work under. Let's go to the second one. Somebody is at a respiratory evaluation unit in a hospital that is at capacity. They're in triage, they're at the entrance of emergency, but that hospital, it's not that they don't want to receive them, it's that they're at capacity and can't. So here the dynamic would change a little bit because the hospital is the one here that calls the telephone lines and takes the next step. Because there are thousands of people who are making an effort to give you an answer. Call these numbers and you'll be able to get information. It would be the same scenario. They would send the ambulance to the hospital that's at capacity and take you to another one. Let's look at the third scenario. The patient is in public. They're in public because, well, they went out to do an essential activity or for whatever reason, they're in public and they start to feel poorly. It's the same procedure. Call 911 or call Locatel, and at that moment, you will be able to, they'll be able to find out where you are geographically. They want to, because of course they want to send you to the closest hospital, and then you get to the hospital that way. In these cases where on the telephone line, someone is in public and they're in a car and they have somebody else there beside them, perhaps it's better for them just to drive them directly to the hospital so that they don't wait for an ambulance there. But that's why it's so important that during this process, we have things moving orderly in an orderly fashion. Perhaps they'll tell you on the phone, it's better for you to go with your car to this hospital and they'll be waiting for you there. I think this coordination effort it's one of the best news. It's the best news we've had lately because we can't let our hospitals get over capacity. What is the good news? Health professionals are ready and they're there and they're ready for what's coming. And with the city, they have seen exactly how Dr. Lopez Catel showed us. We can see where the hardest part is coming. We can see that the hardest part is in front of us. But our medical personnel is ready and they're waiting to help save the highest number of people possible. That is all on my behalf for the moment. Thank you, Maestro Soy Robelo. Now, just so that you aren't confused, what Claudia Scheinbaum described and what Maestro Robeldo was describing applies to Mexico City. Also, the call to Locatel. This is obviously a service from the government of the city of Mexico. Q&A. You and you who has never participated. Thank you. Good evening, Poncho Gutierrez. There have been some reports on social media on behalf of healthcare professionals, doctors, and nurses, and they're saying that they've been overshadowed by bots who are reporting fake news. And there have been complaints, some irregularities, and the like. I know that you've commented on this, but just so that they can hear, is there any telephone line or any place that they can go to follow up with these reports? And many Mexicans want to donate money. They don't know where to go to do that. Should they go to a NGO? What do you recommend for Mexicans who want to give extra money but don't want to go out of their houses? About the second thing, what I can say is donations are welcome. Every donation with no ulterior motives are welcome, very welcome. We have numerous mechanisms for people to do that. At the Ministry of Health, there is the head of well-being. This is a very old institution. This is part of the Ministry of Health. It's sectorized. And this is the well-being fund, which has helped us to channel that. How can we do that? I don't have the telephone number right now, but we will make that available for you. For now, it could be at IMSS. Yes. Truly, this is a great idea that you just put forth. We want to hear our health professionals. This is the most important thing for us. We don't want people to be confused with other campaigns. The first piece of information is we have our we have 1-800-623-2323 where you can report problems. There's another one, soe.robeldo at imss.com, and you can send me the reports straight to my email address. Everything can be anonymous, but you know what? It's really helpful for us to have those comments when they say, someone is not giving us our personal protective in equipment or whatever it is. I would really like you to please send me my email, zoe.rebeldo@imss.mx. And then there's a really great team over at the Mexican Social Security Institute. We have 450,000 workers. It would be hard to answer all of them, but we do have a high level of urgency to deal with this right away. Zoe.robeldo at imss.mx. Thank you so much. I'm from De La Neta Noticias. Doctor, in a telephone interview, the head of nephrology at the Cardiology Institute, Magdalena Madero, pointed to Mexico City being in a critical situation because it's getting to the point where they're going to have to decide who's going to receive palliative care because they're not going to have all they need to give everyone access. What can you tell us? How is it going to work about deciding who's going to receive palliative care? And then in terms of the ventilators, we've seen that they have been buying those ventilators from the son of the CFE director, and they've been selling those ventilators at a very high price, much higher than market value. What is the price? Is it regulated? Why would they be paying those exorbitant prices? Yes, I heard that interview that you're referring to, Dr. Magdalena Roballo, who is the head of nephrology at the Cardiology Institute. She's a very competent professional. She's very educated. I respect her very much. What she was talking about was this phenomenon that we're working on with the redistribution. Now, just like we said this morning, the three national institutions that were designated as COVID, Nutrición, El INER, and cardiology, they got to capacity, they reached capacity because of their prestige and importance. And that meant there were so many people who were going there. They went there. So, yes, it did get to a critical point in terms of occupancy and capacity, even though there were other areas available. And they're just as good, these other places. They're just as good. So with it's just the same as the initiative that we mentioned in the morning, the redistribution among hospitals. I'd like to answer very quickly. We we were talking about this ventilators. We have 35 representatives and they're all doctors, nurses from social service with a long career behind them. And they were looking for who was going to supply this. Dr. Claudia Diaz, who is our representative in Hidalgo, she was looking at three criteria to decide. The first was the opportunity to immediately deliver those ventilators. That's the most important thing right now. Who can hand those over right away? The second was what model. Not all ventilators are the same. There are some that are certified and they're used a lot in social service, and we know them and we have experience with them. And there are others that are more novel. And in terms of a global saturated at capacity market, that's an issue. Also, the availability of pieces. How many pieces can we get? We had 20 ventilators that we were going to be receiving. And then the best conditions. But I spoke with the doctor today. She is someone who has been 22 years in social service. She's a pediatrician and she has a specialty in hospital administration for public health. She is really someone who has no spots on her record. And I think it was a pretty big thing. She's going to give a press conference tomorrow to explain step by step. What's important right now is transparency. We need equipment that is going to save money, but we need to be transparent about how we are acquiring that. We are going to learn more about that in Pachuca, and we're going to hear a press conference by the doctor. Thank you so much. It's 8:01. Thank you so much, Governor Scheinbaum, Dr. Alomia. Good evening. We'll see you tomorrow.